My name is Matthew Brennecke. I'll be doing a Foley catheter insertion on a female patient today. We begin by checking the medical record and making sure there's an order in place. After we've secured that, we'd check for PPE restrictions, and then we would enter the patient's room. Hi, Ms. Anderson. My name is Matthew. I'll be taking care of you today. I'm a student nurse. Can I get your full name and date of birth? Perfect. Then, do you have any allergies for iodine or latex? No? Okay, excellent. Today we're going to be doing a Foley insertion. It might be a little bit uncomfortable, but it'll be quick and smooth, and we'll be in and out as soon as we can. All right, so we first begin by making sure the room's nice and private. Make sure the curtain or door's closed. And then we would pull back the sheets. And then have the patient lift their legs up with their knees flexed and open. All right. And then we would start with perineal care. So first we do hand hygiene, and then don clean gloves. We fill up a bathtub or use bath wipes and get some hot water and soap, and get our towel ready. Use the square technique. Tuck. All right, Ms. Anderson, we'll be doing some perineal care. Curtain back. And it's important to go front to back. So, and then use a different corner of the washcloth for each wipe. All right. And cover her back up. All right. And we would move our gloves. Perform hand hygiene again. Over. Then we're also going to set a chuck down. What I should have done was had the chuck down before perineal care. That is not me. All right. Then we will begin by opening up our sterile Foley kit. All right. Begin by getting our sterile gloves, opening away, drop those out, throw them in the trash. Alright, begin with the right glove, donning our sterile gloves. get a pair of sterile gloves that fit. Alright. So after that, we'll begin by getting our sterile pads. And we are going to put the shiny side down. So flip. And then making a the airplane. Alright, then getting our other pad, sterile pad. The shiny side down again. So, sorry, I just broke sterility there, but it's still practice. Shiny side down, same technique. And then we're going to take our entire kit. There's this section. Set that down right there. Bring this over. All right. We're going to begin by getting our setup ready. So first, we are going to want to first we open up the lubricating jelly. We'll set our peroxide and iodine to the side for now. Open up our lubrication jelly and squirt a little bit right here in the corner. Toss that. We take our hydrogen peroxide and cover our cotton balls. Toss that. And then our iodine solution. Cover those in the cotton balls. Toss that. And then we're gonna take our forceps, get our cotton balls nice and drenched in the solution. And bam, set that down. And then we're going to take our catheter out. And then set it, rest it in the lubrication jelly. And then before we take off our saline, and hook that there. All right. All right. Then with our non-dominant hand, we're gonna lift the curtain. We're going to take the sterile cotton balls and clean each lip of the labia, front to back. Toss the cotton ball, labia front to back. Toss the cotton ball, and then one down the middle. Toss that. All right. After that, we're going to make sure our Foley is good, and it'll be covered in about 2 to 3 inches of lubrication. With our non-dominant hand that's no longer sterile, we're going to open up the labia and begin inserting. We're going to have the patient brace like they're going to the bathroom, and then take a deep breath. And we're going to slowly insert. We're going to insert until we get urine return, and then after we get urine, we're going to push forward 2 to 3 more inches. So we just hit urine, 2 to 3 more inches. We're going to hold the catheter with our non-dominant hand, and then we're going to inflate the balloon inside the catheter, about 10 mLs of saline. slowly inflate. And then I'm going to assume it finished inflating all the way. We'll take the saline off. Okay. Finish holding that there. We then pick up our bag and hang it off of a movable part of the bed. Oh my gosh. Then we would secure with a Foley leg bag. All right, we cover the patient back up. We clean everything back up, dispose of our gloves, perform hand hygiene, and then that would be the catheter insertion. And then for catheter removal, we'd come back in, repeat the steps of removing the medical order to make sure catheter needs to be removed. Introduce ourselves, explain to the patient we're doing a catheter removal, check for allergies, and then we would perform hand hygiene again. Don clean gloves. Explain the patient. We'd have the patient hold their breath and brace down. We remove the leg strap. Lift up. Tell the person to hold their breath. Open up. And then, oh, completely missed a step. Drain the balloon. And then you do not want to pull on the plunger, you just want to let it fill back up slowly. Very slowly.
1342.
Okay. So, after the plunger is finished, you'd want to coil it up and remove it. I'm currently running out of time, and the plunger is draining slowly, but you would coil it back up, wrap it up in the chuck, and toss everything, and then perform or wash your hands, discard these gloves, and then don new gloves and perform perineal care. And that would be removing the Foley catheter. So yeah, all good.